Okay, good.
Hi there. Right, hello everybody. For those of you who haven't seen me, met me before, I'm Tracy from East Riding Aesthetics and Wellness, and I am thrilled today to be having a chat this morning with Dr Arturo Almedia, who's our visiting surgeon here. And really, I could tell you all about what he does, but the best person to tell you about that is Arturo himself. So I'm just going to hand over. Good morning, Arturo.
Hi, good morning, Tracy. I'm so excited to be here with you. I think this is going to be a great morning, sharing with your audience about this exciting news that we have for them. And yeah, I mean, my name is Dr. Almeida. I'm a consultant surgeon, and I will be also the surgeon at Tracy's clinic, right? I mean, I'm so excited about that. And the idea, well, I'm going to give you first a bit of my background. As I said,
Yeah.
I'm a consultant surgeon. I've been practicing surgery for, my gosh, I mean, like 25 years. I practice in Spain, in the United States, in Switzerland, in France, in many countries. Then I started to get into the aesthetic arena 14 years ago. I was a bit of a, of just by chance, because I was doing back then loads of vein procedures, and eventually my patients started to ask me for all the cosmetic procedures. So here I am 40 years later, and fully into this exciting world. I have become, a renowned speaker for many congresses. I've been blessed to be invited to talk and lecture thousands, literally, of practitioners all over the world in different countries like Spain, Luxembourg, Kazakhstan, Russia, all of these places. And the main thing is that I really enjoy this for my patients. And I'm also a teacher. I consider myself a teacher, and I do a lot of training for the doctors. So that makes me be always on the edge, always trying to get the best for my students. And also that will benefit you as a patient, because I'm going to give you the very last technologies, the state of the art technologies that are currently available for the problems that you may have. So that's basically me. I'm based in the beautiful Yorkshire. I'm originally from Spain, but I've been living here in the UK for 5 years, and I fell in love with Yorkshire, to be honest.
It's
I
a
really love
fabulous
this.
place, isn't
Oh
it?
my goodness, it's
Yeah.
so beautiful. You know, the interesting thing is that a lot of people in Spain, when I told them about that I live in England, it's funny how people that are not in England, they relate England to London exclusively. And
Yes.
even though after all these 6 years, they keep asking me, how's London? I said, I don't know. I mean,
No
I go to
idea.
London for, to teach other things, but I'm really happy living up here. I mean, there's a world outside London, and I'm so happy and so blessed to live here in Yorkshire. This is going to be, it is actually my home.
Yeah. Yeah. Well, we made you a Yorkshireman, haven't we?
Yeah, exactly. It's Yorkshire is my blood now.
Yeah. Yeah. So I'm really excited that you're working with us at East Riding Aesthetics and Wellness, because because of your pedigree. Really, you're really quite well known. You're an amazing surgeon, absolutely excellent at what you do, and we're good friends, aren't we? So it's great that we can collaborate and work together, and that you will come to East Riding Aesthetics and Wellness, our small clinic in Beverley, to see patients that are in this local area. But
Yeah.
tell me about what you can offer.
Well, it's clear that you and I are good friends because you
Yeah.
say all those nice things about me. But no, but the truth is that, yeah, I can say that I've accomplished a lot of things, and with those experience, I've learned years ago that sometimes instead of people going to the surgeon's clinic, it's really good service and helps them, massively if the surgeon goes to where they need to be. And because we all love to go to, to places that are close to our places, our homes and stuff. And I've learned that the people really appreciate that. So this is the reason that when we talked about this, like some time ago already, I mean, because the pandemic interrupted everything,
Yeah.
right? But I feel so excited because first, I love Yorkshire. First, we are obviously good friends, and I love you. So it's like about I can help you and your patients to achieve these things that perhaps you are not currently offering them.
Yeah.
Although I know that your clinic is so well known, it's been a recent finalist of these amazing awards and stuff. but you are always trying to give more to your people, and this is what I can just give
Yeah.
to your patients. So basically, even that is true, I'm also a cosmetic doctor, and I do lots of cosmetic procedures. I'm mainly focused in three areas, okay, which are basically fat dissolving injections, which I'm one of the most renowned experts, not just in the UK but also in the world.
Very much so, yeah.
Second, vein treatments, which I've been doing for almost 20 years. And by vein treatments, I mean from cosmetic veins, the spider veins, thread veins and stuff, all the way to the real bulging, big varicose veins that need to have a special treatment by a specialized doctor or surgeon. And the third area that I found is really, really helpful for our patients is what we call minor surgery. Minor surgery is this area of surgery that we treat these minor lumps or bumps. But the reason I say minor is because for the patient, they're really important. They really bother the patient, and they don't want to have those lumps. Sometimes they are a bit scared about whether or not they should be excised, whether or not this could be malignant or not, all those sort of things. Well, this is another thing that I'm really focused. I'm doing these treatments in different places in England, not just here in Yorkshire. And this is why I'm so excited about this. So, Tracy, I have prepared a brief presentation where I can just, so your audience can clearly see these three things that I'm talking about. So, can I share this?
Absolutely, go for it. Totally,
okay.
yeah.
Fantastic, thank you. So, just wait with me a minute, and this will be the screen. Okay. So, can you hear? Can you see this? Yeah. Okay,
yeah,
good.
perfect.
So as I said, the first treatments that we're going to introduce into your clinic are the fat dissolving injections, or lipolytic injections, or non-surgical lipolysis. All these names are used, and these are treatments that where we inject a substance which is a natural substance. This is important because a lot of people is concerned, what is this stuff that you're injecting? Well, this is a natural thing that we inject in that literally melts the fat away, destroys the fat tissue. And by doing so, we can treat conditions without any surgery, like, for instance, double chin, which has become extremely popular. In fact, has become one of the most sought after treatments, not just in the UK and worldwide, because it's perceived. We live in the selfie area. We want to look perfect in our pictures for Instagram and everything. Double chin can be easily treated with fat dissolving injections. I've been doing this treatment since 2008, so quite a few years already. I've been training these treatments to other doctors worldwide since 2011, and I can guarantee you that these treatments work, assuming that we are properly selecting the patient. Because sometimes, and this is something that we may talk in the future, what is perceived as double chin is not necessarily just fat, and they may need other treatments that you, Tracy, can provide to them. So if this will be a team, which is another thing that we love about our partnership, that we're going to be working as a team, not just as a solo practitioner. Also, we can treat the tummy, love handles, bra roll. I mean, ladies, these rolls of fat that sometimes are visible when you put your bras on, that can be treated with fat dissolving injections in a couple of sessions with really good results. Saddlebags, that's another problem. Bingo wings, that when there's a great solution for that. And this is just a before and after picture that we can achieve with fat dissolving injections, before and after. And as you can see, this area here has completely changed for this patient, and obviously this has changed her life. One thing that I want to say though, this is not a quick fix. Don't trust on those amazing magic results that happen overnight that some people post on Instagram, on socials, because those are not simply true, okay? This is really, really important to understand. It takes time, it takes a proper medical assessment, and the results, yes, can be as spectacular as these ones, okay? This is for fat dissolving injections. The next treatment we were talking about is, as I said, vein treatments. Vein treatments could be from non-surgical treatments to treat cosmetic vein treatments, thread veins, face veins, but also the bulging varicose veins. And for that, we're going to be providing 4 different techniques. The sclerotherapy, a lot of people may be familiar with this. This is where we inject a substance within the vein to eventually shut down the vein will disappear. But I also use thermocoagulation with Thermavane, which I'm a key opinion leader for, and I've been using this device for 8 years already with amazing results, particularly for face veins and other vascular blemishes. And I can tell you, yes, I do have a laser. Yes, I do laser treatments as well, but I can tell you that with this technology, the results are far superior compared to laser, and what is more important for the patient, they are almost pain-free. Foam sclerotherapy is similar to sclerotherapy, but here with foam sclerotherapy, we inject a foam without the veins, within the veins, and the veins eventually, first, they get a bit swollen, inflamed, but eventually they will disappear, and the symptoms, when present, will be gone. And in fact, Tracy, we have treated already some patients in your clinic, and I can tell you that they are absolutely delighted with the initial results. And the technique is safe. It's been used since the 1960s, and it works really, really good. And the latest technique that I wanted to share to you today is the endoluminal ablation with glue, which means that we can put some type of energy-based device like laser radio frequency to shut down the vein, but also, and this is a very, very, very new technique in the UK, we can inject a specially designed glue, like super glue, that immediately seals the vein, and the vein is gone forever. And this is something that I'm launching in the UK with one of my business partners. And this is going to be a revolutionary treatment to treat varicose veins. These treatments are not for cosmetic thread veins, spider veins, but for varicose veins. And all these treatments will be available now in your clinic, Tracy, which I think is great news for your patients.
Amazing. Yeah, really.
And then minor surgery, I know this, don't get so, oh my goodness, those photos, I know, but let me get you explain. Minor surgery, as I said, is about treating those lumps and bumps that they are not like medically, how can I say this? They are not serious as, I don't know, a liver problem or a stomach problem or something, but they're very bothering for patients, and they really want to get rid of that. And unfortunately, sometimes they struggle to find a place to get rid of those because not a lot of clinics are offering this service. Obviously, and this for the safety of your patients, Tracy, your clinic is CQC registered, which means that we can definitely do this treatment because it's registered, it's a medical setting. You always say, well, it's a small clinic. Well, I can say there's a very well-known clinic which complies with all the required standards to be able to offer these treatments. You can't get these treatments at a cosmetic clinic because most of them are not CQC registered. I think this is a very important point, and this is something that you, Tracy, deserve, Mary, because I know how hard is the process to get your clinic CQC registered. So going back to minor surgery, we can treat lipomas. Lipomas have those lumps that sometimes are visible in this under the skin. They could be big enough to need like a bigger surgery. They're basically accumulations of fat tissue. Those can be easily removed and without pain. And in our clinic, at Tracy's clinic, sebaceous cysts, like for instance, this photo depicts one of my patients that had in the scalp. These are commonly occur in the scalp, but also may occur in the back and other locations. And this could be as big as these ones. Look at the size of this cyst. And these are the cysts that I excised from that scalp in an operation that took me less than 30 minutes to perform, obviously with no pain for the patient. And the good news here also is that, they get in, get the surgery done, they get out, they can do the daily activities without interrupting their normal life, which I think is also great news. And again, in a CQC registered premise, which I think is really important. Skin tags, oh my gosh. I mean, a lot of people ask for the skin tags, all of them, particularly frequent around the neck or also under the armpits. Well, we can also remove those sometimes in one session, but have experienced that some people have so many skin tags, they may need more than one session, but we can sort them out. I mean, this is another thing that we can do for your patients. Moles, which have come in more and more useful, so we can excise the benign moles, and also we can give you an assessment of your moles in your body. So in case that you feel that this is, I don't know what to do with this, should this be removed? Oh my gosh, if I go to GP, it's going to take ages for that to happen. Well, you come to us, we're going to assess them all, and if needed, we will excise it. And if indicated, we will offer as well a pathology service where we will send the sample off, and then a pathology will just review that under the microscope and will tell us whether or not it's benign, which is most cases the case, or is something that we should do something about, an additional treatment or something. But then you will be sorted. You don't have to wait. You won't have this anxiety or, oh my gosh, whether this could be good or not. Shall I go to GP? Shall I go to private dermatologist? No, we can sort that out for you here at Tracy's Clinic. Warts and condylomas. Warts are so common, particularly in kids. I don't know, Tracy, I've seen more and more often in kids warts. And
Yeah.
I know these are normally related to stress, because I
Yeah.
had experience when I was a kid, they have warts that they keep coming back, keep coming back till one day they disappear. But yes, we can treat those warts with a minor surgery with no pain. And if they need to be retreated, we will be happy to do it again for you. This is just a small list of things that we can do for your patients, Tracy. And the idea, I mean, the reason I prepared this brief presentation, I want people to really get a proper idea of we can offer that in that now we're offering this in your clinic. And I'm so excited. I mean, I just can't wait to keep seeing your patients, because I think our team, and as I said, I think it's important. We're going to be working as a team. I mean, Tracy, you are an experienced professional, many years of experience, a multi-award winning, professional. I know that. And so it's about getting our two minds together, our two expertise together for the benefit of your patients. I think that's going to be great, simply great.
Totally agree. Yeah, I'm really excited. And for me, exactly what you've just said, it's about, potentially, if I wanted to do, I could go and train and do a few of these procedures that you do. I don't want to do that because you're the expert, you're the consultant surgeon. And why would I want to give my patients anything less than that? The absolute expert, the best that there is. So for me, that's really important. What I deliver, I try and deliver to equal the best in the business.
Yeah.
And for me, when it comes to all of the things that you offer, that's your good self. So I think it'll be an amazing offering to the patients. I've got the most amazing patients. They are fabulous.
Yeah.
And just to be able to offer all of those services nice and locally, really conveniently for them. I'm buzzing. I think it'll be great.
I think it's going to be great, Tracy.
Yeah.
I do believe in teamwork. I mean,
Yeah.
likewise, I mean, I can do all the treatments that you do, but what's the point? I mean, you're an expert of these things. I mean, plus you do some things that I don't do. So can I jump into training and get and learn them? Yes, but what's the point? I mean,
Yeah.
we have an expertise in certain areas, and there are other people who are experts in other areas. And I think that for the benefit of your patients, the key thing is not to try to do everything ourselves. No,
Yeah.
it's to work, it's teamwork. Because if you
Absolutely.
get people that, you're much better than I am for, for fillers and toxins. So what's the point for me doing that when I can do it? Yes, but my main things are the things that I just mentioned. So, and I'm completely focused on that. And even for my trainees, that's what I train. I train partners of injections, minor surgery, and vein treatments to doctors. Can I train other things? Yes, but there are people that can do that much better than I do.
Yeah.
So yeah, I think it's the way really to work, the wise way to go.
I think so. So the way that we're expecting it to work at the moment is that we're going to have a day a month, aren't we? Of your good self visiting us at East Riding Aesthetics and Wellness. There may be some flexibility if we need to flex around a patient a little bit, like that.
Absolutely, yeah. I mean, some people they have this urge to get this treatment done for any reason, because I mean, perhaps they are anxious about certain things, or they need to get the fixed. We're going to be flexible for you guys. I mean, we will have these fixed dates, so you know exactly the days I'm going to visit in is right in aesthetic clinic and wellness, or if needed, Tracy will be in touch with me and say, please, can you come over? And
I'll make you a really nice coffee.
Oh, by the way, your coffee is really, really nice. I can tell that.
Yeah, brilliant. Yeah, so going forward, our first official date is the 15th of February, I think, isn't it?
Yeah, it is.
And I know that a number of people have contacted you already.
Exactly.
So the diary is getting full, but if people are interested, please do feel free to reach out, get in touch, and the first port of call is actually usually a video call with yourself, isn't it?
Exactly. I mean, as you can see in my screen here, there's a contact email here up here, so they can just write me an email. I advise you guys to contact Tracy first. I mean, she will give you like the first, idea whether or not could be suitable, and then a lot of people will contact me first on a sort of a video consultation. Sometimes it could be a full medical consultation online that we've learned to do during the pandemic, which I think is one of the blessings of the pandemic, because we can see people from all over without them to come to the clinic. I think it's great for everybody. And then if suitable for the treatment, I will see them on your clinic, Tracy, the day. As I said, we're planning to have this monthly basis, but hopefully, and this happened, I'm sure they will happen. With more demand, we'll be increasing the frequency of my visits to your clinic.
Brilliant. Perfect. Okay. Great. Right. Well, I think we've probably spoken for long enough now, haven't we? Hopefully in the future, we might be able to bring you some little videos around specific treatments as well, with a little bit more in-depth information. And certainly if anybody's got any questions, just please get in touch, and we'll do our best to answer those and support our patients through these treatments.
Absolutely, Tracy.
Brilliant. Well, thanks so much for joining me today, and I shall see you again soon.
Okay, thank you, Tracy. Have a lovely day.
You as well. Take care.
Okay, take care. Bye.